Thanks, Leah. Thank you. Thank you. Well, everybody, how do you follow great leaders like that? It's pretty hard, isn't it? Follow General Steele and Marcus Capone, people who are inspiring, people who care. We are lucky as Americans to have leaders like that. And General Steele is one of those men who you knew that if your son or daughter was going to go out and serve, you'd know that he would do everything he could to bring them back safely and that the right thing would be done. And I can't salute and recognize them, but also salute and recognize all of you. Because I think what I've seen today, I've seen the past several days in this conference, is that you all share that spirit. You all share that commitment. You all share in concern. And what we're here to do is to make sure that all Americans are as healthy as they can be, that they can enjoy their lives and feel gratified in their lives, and that we're all doing our part as a community. So I salute you all, and I'm grateful to be able to also participate and contribute in this endeavor. What we've done here, I want to sort of lay out, because you've felt the power. Now it's kind of like, how do you get to work? How do you get to, this is not sexy, this is not glamorous, this is just kind of nitty-gritty, as we call in the Army, in the foxholes, and you just kind of grind away in terms of what we're going to do. So let me just tell you how we've got to this position and open to you and engage you in the proposition of what we all can do as a team and collaborate in terms of promoting what we all feel so committed to when it comes to healing ourselves, our families, and all those people that we love and live with. To take you back to the experience of Leah asked me as we were preparing for this, how did you get here, Steve? Well, I came into this actually as when I was commissioned in 1970, and I was a young doctor in San Francisco. I was serving at the Army hospital there. We were getting every day plane loads of casualties from Vietnam. We didn't know what the diagnosis of PTSD was, but we knew that these men were really carrying something, mostly men, there were women also, carrying a very heavy burden, and their families were carrying a heavy burden. But all you had to do also was go out into the streets of San Francisco and watch all sorts of other young people that had come from a background or lives that were also very much affected by that and carrying that burden. And so our responsibility, our commitment as physicians, as Army officers, was to do what we could with everyone to help them heal and get over the trauma or the experiences that they had endured. You all know the story. And in those days in San Francisco, it was terrific. It was wild, but it was terrific. You know, it was great. And with the right teachers, and we had great teachers, we had great experienced physicians and leaders, we could start to think about all the different possibilities of how we might take any number of options of treatments, of things that are being used now that are available to you, and see how they would help and heal. Well, the sad thing is that it went off the rails completely. It broke. It broke in part because of President Nixon's decision politically to criminalize these substances. It broke in part because we didn't know as a profession of how to go about and methodically figure out what worked and what didn't work, who should get treatment, under what circumstances, who should also have healing experiences available to them, because sometimes it occurs in a religious setting, sometimes it occurs in a lay setting. Who should be able to do that? Fast forward to about a little over 2 years ago, and I was speaking with one of the incredible philanthropists who asked me, based on the experiences that I've had, could I propose a way of moving forward and fast-tracking these treatment modalities and these healing modalities so that they would be available sooner than later? I mean, just as we've heard, amongst suicides, amongst our soldiers and veterans, all the other problems. And it was in the middle of COVID, start of COVID actually, people were feeling all the stress. Was there a way to methodically go about that? Well, I said, well, that'd be a great thing to do. It's a little bit of a rerun, but let's think back and get the lessons learned. How do you build a campaign plan? How do you go about when you've got committed individuals like all of you, individuals and professionals that want to do well and are looking at this from your particular expertise and investment? How do you bring everybody together so that they can collaborate and we don't make the mistakes we made 50 years ago, or maybe hundreds of years ago? Because these compounds, as you know, have been around for thousands of years, and they've been used in healing, but somehow they have not been, quote unquote, mainstreamed. Well, you start off, I said, okay, what we're going to do is a typical exercise that we learn as young officers is let's just map out the universe. So you'll see what we think are the issues that would come together if you were going to build a campaign. Don't get alarmed. If you don't see your issue out there, that's okay. We're just, calm down, breathe. This is just a heuristic. This is just a start point. And that is, let's look at the universe that we have. Let's look at who might be particularly expert and invested in a particular issue, like training or ethics or supply or pharmaceutical safeguarding, or faith. Who might be good about that? And let's figure out how we can put up the big tent and bring everybody in and start getting everybody talking to each other. Now, who can do that? Well, I think, maybe some of you don't agree, this is what's great about this country. In this democracy, in this republic, other than any other country that we can think of, I got 2 minutes. What the hell, Not the first time, So let me run through this. Is you got to build a big tent, you got to bring everybody in, but this is where I think good government works. Now, I know a lot of you think that that's an oxymoron, you can't have good government, but we do. Because this is a great country, and we engage the federal government with all of us in our private roles, all of us, so that we can come together, collaborate, and advise on what might be the best optimal policies and programs, and we don't make the mistakes we made 50 years ago. Now, I'm technologically challenged, but maybe I can do that. What do you know? There is a mechanism that, in fact, I've had an opportunity to advise some of the senior leadership of our government. There is a mechanism that they have called a public-private partnership. And that is in consideration right now. And it brings, through that mechanism, it's been used now for many years in looking at opiates. It's been used at looking at, I think it's going to be used to looking at long-haul COVID and all that, where we can convene all the different parties, have the conversations about these issues. These are all the stakeholders, and there are others. And then from there, we can come together and decide now what's probably the smartest way to go forward. If you're going to use this in a clinical setting, how do you prescribe it? How do you train people? How do you monitor it? How do you know that the right people are being treated? If you're going to use this in a sacramental setting, I'm done. I'm over, but think about that. And if you're going to use that in a lay setting, we know from the military that there are soldiers who were willing to go to the shrink. There are more soldiers who were willing to go to their chaplains. And there are more, right? That's okay. Because what's our goal? Our goal is healing. Our goal is that everybody here has the best life that they can. And that we all are linked, we all are arm to arm, and we all are doing what keeps us and keeps this country viable, vigorous, and healthy. So with that, I'm done. Thanks.
Thanks so much, General XENAKIS. Sure hope that some of these wishes may come to fruition. We shall see. Next, please, let's welcome Brett Waters. Brett is an attorney with Winston & Strong in New York City and co-founder of Reason for Hope and the Veteran Mental Health Leadership Coalition. Brett has played a leading role drafting legislation, briefing federal and state legislators on both sides of the aisle, and preparing policy recommendations for various Biden administration and independent agency officials. Brett serves as the Policy and Advocacy Chair of the American Foundation for Suicide Prevention, the New York City chapter. Please welcome Brett Waters.
Thank you, Leah, and thank you all for being here today. I'm going to start, get a little bit personal here about what brought me into this space. As Leah mentioned, I'm the co-founder of Reason for Hope, which was named in memory of my mom, Sherry Hope Waters, who I lost to suicide in 2018. Before that, I had lost my grandfather to suicide when I was young, and decided, that the way that I grew up, which was without knowing what happened to my grandfather, my family never spoke about it. It was just kind of a hidden family secret, was not the way that I was going to move forward with my experience. And I got involved with the American Foundation for Suicide Prevention, doing policy and advocacy work. And along that way, I came across the research in this field. And it immediately clicked for me from my own experience that I had with an eating disorder that I really, had my entire life. It's a hard one to explain. It's like a phobia of food. It was an inability to eat anything other than like very basic childhood foods, very socially debilitating, and something that I hid my entire life until after I had an experience with psilocybin in college, just recreationally, and the anxiety that I felt about trying new foods, which was, I just couldn't do it. I would gag it up immediately if I even tried. And I had this one experience, and all of a sudden, it was just gone. 6 months, I could just eat new foods like a normal person. And it really, changed my life. That experience was, certainly something that I shared with my friends who saw it, my family. My mom knew, my dad knew, and for whatever reason, I really never looked into it further. Why did this happen? What's the science behind it? And by the time that I did, it was too late. I lost my mom, and went out and after seeing this research and getting involved, more deeply in this space, while still with the American Foundation for Suicide Prevention, started working with a lot of these different veteran organizations, people who were doing everything that they could to leave the country to get treatment for themselves, for their families, for their loved ones, incredibly inspiring and really inspired me to get more into this work, but also there is a strong sense of guilt that also drives a lot of what I have been doing in this space, that how did I not know about this sooner? How did I not look into it? And the more that I, kind of dug into this space and learned more about the law that has been holding it back, the more frustrated I got, and the more passionate I got about really focusing this, on this issue. And so I went out and started Reason for Hope, knowing that, kind of just using my background as an attorney, which is really just not in this space, antitrust attorney. It's an area of law that, for people who are familiar, does not make a whole lot of sense either. It has developed over time that is in a way that is just, it's frustrating sometimes. And, I was shocked to come across something that was even worse. It's really just incomprehensible to try to understand how the Controlled Substance Act works, how it interacts with the Federal Food, Drug, and Cosmetic Act. The Schedule I status of these compounds it's difficult to comprehend. And so, that's really how I got here, and started taking a really active role in doing the federal and state policy work that I've been fortunate to work with such a great group on, people like Brigadier General XENAKIS and General Steele, and Dr. Lynette Averill, our other co-founder, who unfortunately couldn't be here. She's expecting her first child, and just it's an incredible journey to meet these amazing people with such diverse different backgrounds and areas of experience, and just sort of putting that together and working with a whole lot of other people in this space to help drive change. And one of those changes that I think is one that I think a lot of people who are interested in hearing more about is what Dr. XENAKIS was just describing, and that's the potential for an interagency federal task force and a public-private partnership. We had worked with members of Congress on both sides of the aisle and state legislators from a variety of states who had sponsored bills, and as well as the chairman of the Health Committee in New York Assembly, Richard Gottfried, led a letter with a group of stakeholders to Secretary Becerra, suggesting that this task force and public-private partnership would be a good idea to help streamline access to these treatments for people who are in need. And I certainly have my own experience, not just with my family, that kind of motivates my belief that we really need to be doing all that we can to streamline this access. But I also have my own experience with, being prescribed SSRIs after I lost my mom, and just recently, finally tapering off of them after it was my third try. I'd failed twice previously, and I'm, very well aware of the history of, kind of the hype behind SSRIs and Prozac as the new miracle drug. And so, I think what we're really doing here is trying to balance that need for immediate access to treatment for those who have tried everything else and are really struggling, with the need to do it responsibly, safely, do the research properly, and actually make sure that it's not just a drug that goes to market and then nobody pays attention again. We don't do any more studies. I think that there's a need to really better understand how these treatments are going to impact people in the long run. And so we want to have as much research done as possible, and that doesn't mean it all has to be randomized, double-blind clinical trials that cost millions and millions of dollars. There's a lot of other ways to do research, and so that is a big component of what we have been working on in this federal and state kind of coordinated policy strategy, is streamlining access to these treatments, but in a research framework, which is through the FDA's expanded access program. And so what we have done is we passed a bill in the state of Connecticut that sets up a pilot program for expanded access for MDMA and psilocybin-assisted therapy. It will allocate funding for veterans, retired first responders, and direct healthcare workers. The state of Maryland also passed a bill that wasn't quite as specific, but allocates $1 million to provide cost-free access to this treatment. And the federal expanded access program, for those who aren't familiar, is a really, can be a burdensome and administrative hassle. It can be very expensive, particularly for a single patient. And what it's really meant to do is provide access to those who have exhausted other options and have a serious or life-threatening condition. It is a federal program, so what these bills are doing is really not legalizing anything. It is just setting up a pool of money and a framework to be able to group together a larger patient population and work in a public-private partnership with, the states, with the power of the state governments behind us, with a group of stakeholders who are desperately in need, including veterans who, as we've heard of, thousands of them leaving the country, the drug manufacturers and the providers who are, looking for a way to provide access to this, can engage with the government to establish larger protocols. So it's not just a single patient system. It'll reduce the administrative costs. It will make it much easier for providers to be able to actually get patients in need access to treatment now, and they'll be able to have the funding to collect and report the data. The data will be analyzed, and this is the sort of real-world data and evidence that Congress, and for a very long time, has been telling the FDA to start considering in making its treatment decision, in making its regulatory decisions. And so what we want to do is, through these programs, help speed up, hopefully bring these medications to market and be able to get them to people who need them. And so we are, working on a variety of strategies also to make that easier. I think everybody is aware that Schedule 1 of the Controlled Substances Act is highly problematic. We would like to see that the definitions of what Schedule 1 is changed. There are unfortunate political realities that make it difficult to pass anything in Congress right now. But we think that there is some strong, growing bipartisan support for this issue, and that just through some basic regulatory changes, whether administratively or through legislation, that getting these breakthrough compounds rescheduled to Schedule 2 will be a way to make it a lot easier. Nobody, for the most part, has a Schedule 1 license, but almost all doctors have a Schedule 2. And so it's something that can really, again, just reduce the cost and help speed up access to getting patients in need treatment that they deserve. And so we have primarily been working on this mix of legislative solutions, administrative solutions, like Dr. XENAKIS was discussing, and have been also helping with some of the litigation against the DEA that's been ongoing. And I think that that's kind of an important thing to highlight here when we're thinking about federal policy change from not just in the nitty-gritty, but from a big picture perspective. It's not just going to be one of these things. There is no one bill, there's no one administrative solution, there's no one lawsuit that is going to really impact change at the level that's needed. It's going to take all three of those things. It's going to have to take a coordinated effort of administrative litigation and legislation that's going to be an ongoing effort to pressure the federal government to make the change that's needed, and and certainly the state legislation and advocacy can play a massive role in helping to move that forward as well. So I think that we have a lot of work to be done. We have a very long way to go, but I think we're kind of excited about the progress that's been made so far and the potential to help bring these to market for people faster. And then the one other issue that I wanted to touch on, which is one that not the most exciting, not the most exciting thing to hear about. This is very administrative, but there was a great article that was just written by Shane Pennington, another attorney, if anyone's familiar with his writing on the Controlled Substances Act with Matt Zorn on their Substack called On Drugs, that really delves into the details of what the President's recent directive to HHS and the DEA is going to mean for cannabis rescheduling. And the definition to be in Schedule 1 means there's no currently accepted medical use. Essentially, the way that has evolved over time means you have to get FDA approval to get out. It's a very burdensome system, and the fact that cannabis does not itself have an FDA approval means that if it's going to get out of Schedule 1, we need a change the definition of what currently accepted medical use means. It can no longer mean it has to have an FDA approval. We're going to need to consider new evidence of how we even make that determination. In the past, there have been state evidence has been ignored, state bills, what doctors are doing has been ignored. And so this administrative action has the potential to create massive change well beyond cannabis. We are, here for obviously, a psychedelic conference. And so I share all this because, the state of Oregon has passed a bill, or a ballot measure, I should say, to, provide psilocybin services. And the state of Connecticut has passed a bill to provide expanded access and to fund expanded access, as has the state of Maryland. And so these are the kind of things that, we're going to need the community to come together with all of the evidence that has been compiled at the state level, the work that's been done that can go into these evaluations and administrative review that's going to take place, and hopefully chart a new path forward, because it can have seriously major implications on the future of psychedelics and change just their Schedule 1 status, and particularly for psilocybin. So, this is really the kind of nitty-gritty of the legal issues that are standing in the way of progress here, that I'm hopeful that are going to see a serious change in the near future, and look forward to answering some questions about any more specifics that people want to get into. But when Dr. XENAKIS talked about the non-exciting work, this is the nitty-gritty of where it's actually getting done. So look forward to working with everyone to help drive this forward. And thank you all so much for your time, and look forward to speaking with everyone further.
Thank you, Brett. And we're also going to bring back General Marty Steele. Okay. We have a little over 10 minutes to get through a lot of good questions. So the most popular question: what is the status of the Federal Task Force on Psychedelics, and when will it be announced officially? And before I turn this over, I think one of the things that we acknowledge is that there is no one here who's speaking for the federal government. And so I wonder if General XENAKIS or anyone else on the panel could speak to what a typical normal process would be for something like a P3 to be announced.
Sure, I think you're right. I mean, and to emphasize that, so we're not speaking for the government. This is a decision that the leadership will make. In order to announce that there will be a public-private partnership, the first step is to place in the Federal Registry a request for input, an RFI. That has not been placed yet. The timing depends on the decision of the Secretary of Health and Human Services and the others, and probably leadership senior, to the secretary. We can say that those of us who are familiar with that it is in the process. The timing is, something that they have to decide themselves. As you can imagine, everything is political. Everything, okay? So that's okay. This is America. It's a great country. And we're just going to let it be that way, and it'll be just fine. So, but it'll be coming out. I'll be telling you, it'll be here. And y'all get to be a part of that. So welcome.
Great. So let me ask you a follow-up question. So if we were to, take it that this P3, this thing that might happen, could possibly be a good thing, how should the psychedelic community prepare for something like that?
I think first of all, if it succeeds because each of you in your way are going to contribute. And it's a team. This is a team endeavor. And so I think we need to, each of us, appreciate and respect what we can particularly contribute, what is our value added to this, and be able to be as articulate and specific about it as we can be. And in doing that, also respect that there are other people coming to this conversation with opinions and experiences that we also respect and will work with and assimilate in the conversation.
Yeah, and I would add to that I think that people in this room in particular have already been doing it. I think that there is already, the work is going on right now. Everybody has been doing it in different, whether associations at the state level. A lot of the work that needs to be done is being done, and it's bringing it together, making sure that it's cohesive under one umbrella, and the way that, at least the way that we envisioned it when we started with this idea was that by the federal government endorsing it, by publishing guidelines that can go to the states, that is something that can actually streamline and speed up the process for access to care. Just like there's bills being passed right now, including the one that we did in Connecticut that automatically reschedules a drug when it gets FDA approval. Half the states don't have automatic rescheduling, and so that's just one of those boring administrative things that can prevent a bottleneck from happening. This is another one of those things. It is a mechanism to speed up access to care. It's something that would be non-mandatory on states. I think that this is particularly an issue that has appeal across the aisle, is that most conservative states don't want the FDA to tell them what they have to do in the practice of medicine, in the practice of therapy. The FDA doesn't regulate that. The states do. And so this is a mechanism through which we can get some consensus and streamline those recommendations to the states for adoption or whatever changes they need to make. New York and Montana don't have to do things the same way.
Okay, great. Thanks so much. Marty, I'm going to turf this one to you. Given the history of the federal sabotage of the use of psychedelics, how do we prevent such politically motivated demonization of psychedelics in the future?
How do we prevent what?
Condemnation of psychedelics in the future.
Yeah.
Politically motivated. Here, you're the man, you can fix it, right? Here you go, General.
Yeah. Well, I mean, I'm back in San Francisco with him 50 years ago, so when Nixon condemned everybody. So it's well, it's education, in my opinion, again. And I believe we're better today than we were yesterday. And the more we communicate effectively, the better we will be tomorrow than we are today. And that's not a trite expression. But politically, I was sharing with someone in an interview last week, I've never, once we started the process of educating and communicating, never had any politician in the government at the highest levels of our country back away. Never. I mean, once they understand what you're trying to do and how you're trying to go about it, and you're keeping a low profile and you're not really wanting it all out there, if you will, to where it can be shot at, they're in. What can I do to help? How can we make this happen? And, you know, there was a comment earlier about a certain party, one or the other. And obviously, Reason for Hope, all of our initiatives are from a bipartisan perspective. Bipartisan perspective. Both sides of the aisle, state and federal level, bipartisan. We've never approached anything differently than that, and it's amazing. Brett didn't mention it. I thought he was going to do it, but I mean, in this Right to Try Act, I mean, we have Senator Booker, a liberal from New Jersey, and Senator Ryan, a conservative from Kentucky, that got together because of the effort that this man made about that bill on the right to try. So I think that we're headed in the right direction, and will there be puts and takes and fits and starts? That's humanity. That's life. That's how we all get up in the morning. That's why we are engaged in all of this. That's why this is your life, just as he was saying. I mean, you're going to be a part of this process. So the more we communicate effectively, if I would say one point of advice, which I think you've heard, I made a reference about learning to love one another. We just can't afford to have any undermining of people's positions about this, because they think differently, they have a different approach or whatever. But everybody's in the game here to make this happen, and we all bring something different to the table. And so if we do the inhuman things, it's just like war, man's inhumanity to man, the banality of war. We've got to rise above all that in this process to be able to seize off each other's strengths rather than attack each other's weaknesses. And if we can imbue our politicians with that philosophy of life, that's why we're here, to seize off each other's strengths and not attack each other's weaknesses. We're unstoppable in being able to do this. And I know that's a long answer to a short question, but that's really where this is.
So I'm going to ask a provocative question, perhaps. And it is something like, what do you think that the broad use of psychedelics means to the future of warfare?
All right, General. You're the senior guy.
Yeah. Well, I mean, obviously, whether you want to call it psychedelics, but all of you are well read in this space. All of you know about the history of drugs in warfare, if you're reading in this space. And it goes back to the beginning of time and the first time someone clubbed another person to death, whether they were imbued with a psychedelic to get the courage to go do it or whatever rationale they were using behind it. And the fact is that I see we will leverage, I mean, World War II, I mean, it's common knowledge that our enemies in World War II were high on drugs. I mean, that's what made them fight so tenaciously, because they were provided drugs to fight tenaciously. Whether you call it psychedelics or not, so to me it's irrelevant. It's about an altered state in your mind as you're going into harm's way to do the most banal thing you can, take another human being's life in combat. And to give people the motivation, the inspiration to do that is because it's adverse behavior to inspire people to do that, and that's what you have to do in war. Well, but for me, we will leverage this in a very positive way, to make it be value added to how we prepare to go to war, because of the research of the people in this room and how you're trying to make this happen. So I think that it will come to fruition. Maybe not in my lifetime, but in many of your lifetime. I'd like to say, you know, it'd be sure nice not to have to go to war for the next 40 or 50 years, too.
Amen. And I think, just to jump in real quick, I think the question may have been geared towards, is the psychedelics going to make it so we have world peace and there's no more war? Yeah. And I don't think that there's, Who can say that right
Well,
now?
let me put in a plug here since we're at the
I think we
close.
hope so, but I don't think we have, certainly don't have any evidence over history to suggest.
I don't think we do, but let me put in a plug and ask you all to think about some things as we're at a close. As Leah mentioned, I'm on the executive board of the Center for Ethics and Rule of Law. And we look at a number of issues and what the ethical principles that each nation should subscribe to when it goes to war and conducts war. And I will tell you that I think what we're talking about today is that healing is at the core purpose of why we all are committed to this. We should recognize that in the past couple decades, and the latest war in Ukraine, that warfare has changed. It is not confined to any national boundaries. And that means when one people are devastated by something like this, we're all devastated. And if we commit to healing, if we commit to a broad sense that everyone deserves to be able to enjoy and flourish in a life and should be available to them, then we can change the ethics. And we need to influence those ethics, and it is all the voice of every individual. And I encourage all of you to get engaged and speak up on behalf of healing, because that's the way we're going to stop this.
I think that is the note to end on for today. On the note of healing, thank you, Brett. Thank you, General XENAKIS. Thank you, General Steele.